For people who have a history of back pain and sciatica, we want to divide our exercises into safer exercises and danger exercises. It is now time to review danger exercises. Now, a sit-up is usually done in this position if you're on the ground with the knees up, your hands are behind your head or your neck, and go ahead, Chris, do a sit-up. Alright, now let's talk about what that sit-up does. As he did a sit-up, he was pulling on his head and his neck. That, if you have neck problems, that could cause problems with your neck. But right now, let's concentrate on the low back. Well, on his back, he is creating flexion, which means that doing the sit-up is going to create increased forward pressure on the disc right in through here as he does a sit-up, and it can cause bulging of the disc if the disc has an existing bulge, or it can cause increased strain in the disc that as the bulge goes backwards, it can hit the sciatic nerve and cause increased sciatic nerve strain. So a sit-up is not a safe exercise to do. So what you're going to do is something called a pelvic tilt. With a pelvic tilt, you're flattening your low back to the surface of the floor. So we're going to use the skeleton right here. I'm going to put it on top of Chris. And this is the way his low back looks. We have the knees up in this position here because it acts to flatten and open up the low back a little bit and take some of the pressure out. So with this type of exercise, including, by the way, any of the other exercises on your back. If you're on your back doing curls or presses, you keep your knees up because it flattens the back and takes some of the pressure out. If you put your legs out straight, then what it does, it flattens your back. It will cause it, if you put your legs out straight, what it's going to do is cause a little bit more arching. But with your knees up, it's going to cause a flattening of the back. So let's create a position where he's on his back and he wants to flatten it even more. What he's going to do is called a pelvic tilt. He's going to flatten his back and take this curve out and put his low back towards the floor. In doing that, he's going to be tensing his abdominal muscles, which is going to give them some exercise. At the same time, he's going to be tractioning or taking pressure out of his low back. So it's like a win-win situation. So, Chris, why don't you derotate your spine and flatten your low back to the ground. Now relax. Flatten, relax. Flatten, relax. Okay, now you want to do those, you want to work up to about 25 of those or more. And that's an excellent, very safe exercise for abdominals and for flattening the low back. So again, what he's doing is flatten, relax. Flatten, relax. Flatten, relax.